With nearly 23,000 hospital admissions and 1,300 births every year, health services at St Mary's Hospital on the Isle of Wight will affect the lives of most islanders at some point. There's also over 250,000 patients supported by outpatients, NHS 111, the Community and Mental Health Services, and 25,000 emergency ambulance journeys undertaken each year. But the unique nature of the island's health service could be under threat in the future, and there's a real chance that our local NHS integrated services could be broken up and managed from the mainland. To keep your services local, the island's NHS Trust wants to become an NHS Foundation Trust, which will allow islanders to have more control over how and where it spends its funding, ensuring islanders get the best possible treatment.
Foundation Trust is about being excellent at everything we do, treating patients as if they were coming from the private sector. So thinking about their appointment times, is that convenient for them? It's not about the convenience of the organisation, it's about delivering a service that people really want to buy into. So they come, they say, I really want to come to the NHS on the Isle of Wight because it's fantastic. The way they treated me was great, I had the appointment time I wanted, the people were very communicative, they cared about me as an individual in that system, which is actually quite difficult because we treat so many thousands of people every year. I want every one of them to feel special and as if this service is absolutely built around their specific needs.
With a population of around 140,000 people, the Isle of Wight does have unique health issues.
We're very focused on the fact that we've got an elderly population, but obviously the island is not only made of the elderly, and we have the great part of the Isle of Wight Foundation Trust is that we will have the diversity of having our maternity services here, the younger population through the paediatrics departments and other departments as well.
When talking about becoming a foundation trust, it's important to remember it's not just St Mary's Hospital that will be affected. The status would also cover community services such as district nurses, health visitors and other services that are delivered in the patient's home.
I think Foundation Trust for me means working towards and delivering a quality service for our patients on the Isle of Wight, wherever it is, whether it's in the community or in the hospital. For the public, it means that a Foundation Trust means they can become members, which gives them then the opportunity to help make some decisions and be involved in the decision making around what services are developed on the island, whether it's in the community or whether it's in the hospital.
Our ambulance service provides 999 emergency call-out as well as patient transport across the island and, if required, even to the mainland. Its centralised control room in Newport is shared by the NHS 111 non-emergency number. That unique collaboration is something that could be under threat unless we become a foundation trust.
What it would actually mean would be hosted by another ambulance service, probably from the mainland, one of the larger ambulance trusts. We would lose our identity and we would probably lose our standards, which we're very proud of. Foundation Trust actually is a fantastic opportunity for the Isle of Wight Ambulance Service to maintain its autonomy from the mainland and give the public of the island the service it deserves.
Our mental health services provide inpatient and community-based health care, which includes specialist child and adolescent conditions. With 50 beds and community mental health teams, we support around 1,300 patients who have issues that include substance misuse.
If we were being managed by a mainland trust, we would lose that really close relationship we have with our colleagues in the acute side and in ambulance and in community services. And for the patient, that would mean that their care may become a bit disjointed. I think the public should get involved. This is their NHS, this is their island. Let's keep us on the island, become a member of the Foundation Trust and support your local NHS.
As well as medical care, patients at St Mary's are supported by over 400 ordinary islanders who volunteer their time. They work in a variety of roles and provide the small things that can make a real difference to patients.
You're giving something to the patients, you're taking the pressure off the staff that haven't got time to do the things that actually make a real difference to the quality of their stay at the hospital. One of the good things is you're actually a member of the trust, so you feel you've got some input, you know a bit more about what's going on and you can make informed decisions, you can make other people aware of what's going on so that we can all as a community be part of making positive changes.
To get Foundation Trust status, we have to be strongly supported by the island's community. We need to recruit between 4,000 and 6,000 islanders to sign up and show their support for our bid. It's a bit like joining an exclusive club that brings islanders together, but it's free and you can be involved as much or as little as you want.
I know that people here on the Isle of Wight really care about the health service, so I think it is worth bothering. You're going to really make a difference. And as a member, you will be electing your Board of Governors. And the Board of Governors have massive control and power over the way that we deliver our healthcare. So I think it would be a real benefit for them and they could get truly involved in healthcare on the island.